Hello everyone, this is Dr. Humanist again. Let us now study about all the antibodies which are used in rheumatology. Okay, so starting with SLE. What are antibodies we are getting here? ANA, that is anti-nuclear antibody. It is present in more than 95% cases of SLE, but it is not specific, right? As it is present in other autoimmune disorders also. Okay. Next is anti-double stranded DNA antibody, which is specific for SLE and it is associated with lupus nephritis. Next is anti-Smith antibody. It is more specific. It is highly specific for SLE and it is found in 30% cases of the SLE. Right. Other than that, anti-Ro and anti-La. Okay, these are associated with secondary Sjogren's syndrome and neonatal lupus. Okay, antihistone antibodies. These are associated with, as we all know, drug-induced lupus. What all drugs will cause? That is SHIP drugs. Yeah. S for sulfasalazine, hydralazine, I for isoniazid, P for penicillamine and procainamide. Other than that, even minocycline can cause SLE, and TNF alpha inhibitors like infliximab and chlorpromazine. So this is associated with drug-induced lupus antihistone antibody. Other than that, anti-C1q complement 1q antibody. It is associated with severe lupus nephritis. Okay, and APLA antibodies, antiphospholipid, which is associated with recurrent abortions and venous thrombosis. Right. Next is rheumatoid arthritis. RA. What all antibodies are present? Rheumatoid factor, RF. Okay, it is present in 70 to 80% cases of RA, but it is also not specific, as it can be present in other diseases like Sjogren's syndrome or even chronic infections. Right. Other than that, anti-CCP, that is anti-cyclic citrullinated peptide. It is more specific and it indicates there is a more severe disease and erosive arthritis. Right. Next is Sjogren's syndrome. ANA, as I said, it's not specific, but it is present, and anti-Ro, anti-La antibodies. Okay, it is present in primary Sjogren's syndrome and can be associated with increased risk of neonatal lupus and congenital heart blocks in the pregnant patients. Okay, next is RF, as I said, it can be present in Sjogren also, right? Next is systemic sclerosis, scleroderma. Okay, anti-SCL70, it is also called as anti-topoisomerase 1. Okay, it is associated with diffuse cutaneous systemic sclerosis and interstitial lung disease. Okay, whereas if you see anti-centromere, it is associated with CREST syndrome, that is limited cutaneous. CREST syndrome everyone knows. Okay, calcinosis cutis, Raynaud's phenomena, esophageal dysmotility, syndactyly and telangiectasia, right? So this is CREST syndrome, which is associated with anti-centromere, that is localized form of systemic sclerosis, and diffuse form it is associated with anti-SCL70 or anti-topoisomerase 1. Okay, this is important, you have to remember. Other than that, anti-RNA polymerase 3, which is associated with high risk of scleroderma renal crisis. Okay, scleroderma renal crisis is associated with anti-RNA polymerase 3. Okay, it is linked to rapidly progressive skin involvement. Okay, rapidly progressive skin involvement. Right. Next, anti-centromere just now we discussed. Right. Other than that, now next is polymyositis. It is associated with anti-Jo1. Okay, it is seen in anti-synthetase syndrome, which includes what? Interstitial lung disease, arthritis and Raynaud's phenomena. Okay, next is anti-SRP. SRP, single recognition particle. Okay, it is associated with more myositis and more severe myositis and poor prognosis. Anti-SRP. Anti-PMSCL, it indicates overlap syndrome between polymyositis and systemic sclerosis. Okay, anti-PMSCL. Now next is dermatomyositis. What all antibodies we are getting here? Anti-M12 and anti-Jo1. Okay, anti-M12 is specific for dermatomyositis, as anti-Jo1 we saw it is also present in polymyositis, right? And anti-M12 is specific for dermatomyositis and it is associated with better prognosis and good response to therapy. Okay, whereas anti-Jo1 is associated with interstitial lung disease in both polymyositis and dermatomyositis. Okay, Next is MCTD, that is mixed connective tissue disorder. What we get here? Anti-U1 RNP. Okay, it is highly specific for MCTD and it is seen in patients with overlapping features of what? SLE, systemic sclerosis and polymyositis. Okay, all the clinical features will get. That is overlapping syndrome, right? Next is APLA, that is antiphospholipid syndrome. It can be primary or secondary with SLE, right? Or catastrophic APLA, right? So what are antibodies we get? Anti-cardiolipin, anti-beta 2, glycoprotein 1 antibody, and lupus anticoagulant. These are the three antibodies which you have to remember, because even the criteria of APLA syndrome, that is Sydney criteria, it is there. Okay, three antibodies are present, right? What is it causes? It causes, as I said, arterial and venous thrombosis, recurrent miscarriages. Okay, and lupus anticoagulant is most thrombogenic antibody, right? Some other disorders also we'll see. Granulomatosis with polyangiitis, which is associated with C-ANCA, that is anti-proteinase 3, right? It is highly specific for GPA, okay, which is formerly it was known as Wegener's granulomatosis, okay, which is correlating with the disease activity and the severity as well. Next is microscopic polyangiitis. Okay, what we get here? P-ANCA, that is anti-myeloperoxidase antibody. Okay, and as we know, microscopic polyangiitis, it is associated with pauci-immune glomerulonephritis and systemic vasculitis. Even Wegener's causes pauci-immune glomerulonephritis, right? Same. Next is EGPA, that is eosinophilic granulomatosis with polyangiitis, before called as Church-Strauss disease. It is also anti-PNK positive. Sorry, PNK positive, that is anti-NPO. Okay. Next is primary biliary cholangitis, that is PBC. In that, what we get? Anti-mitochondrial antibodies. Okay, it is specific for PBC and it can help in diagnosis early the disease. Okay, even there is a before the symptoms of fatigue and pruritus appear, if these antibodies are present, we can predict. Next is Hashimoto's thyroiditis. What all antibodies will get? Anti-thyroid peroxidase, that is anti-TPO, and anti-thyroglobulin. Okay, so whenever you are getting a case of hypothyroidism, it is better to do the antibodies test. We can differentiate either it is because of autoimmune disorders like Hashimoto's or because of dietary. So the patient can be told that by it is your autoimmune condition, so you have to be like lifelong, it will be there, it won't go easily. But if it's not, the antibodies are negative, which are commonly present, 70 to 80% cases of hypothyroidism, you'll get this. If they are negative, then you have to tell that the diet, if you change like cabbage, broccoli, cauliflower, if you stop taking that, your hypothyroidism might get cured, right? Next is Graves' disease. What all antibodies will get? Anti-thyroid peroxidase, that is same, anti-TPO, anti-thyroglobulin, same. Now one more antibody that is we get specifically, it is TSH receptor antibodies, that is gain of function. I mean, when you stimulate the TSH receptors antibodies, there will be more and more production of thyroid hormone, right? Next is myasthenia gravis. The most common antibody we get in myasthenia gravis is anti-acetylcholine receptor antibody, present in 85% cases of generalized myasthenia gravis cases, causing muscle weakness, as we all know what happens in myasthenia gravis. Other than the anti-MuSK antibodies, there are some 3 or 4, but these 2 are main. Okay, and anti-MuSK antibodies are associated with more severe course of disease, myasthenia gravis, and in the especially who has acetylcholine receptor negative antibody. Next is Goodpasture syndrome, that is anti-glomerular basement antibody. Okay, it is specific for Goodpastures. It causes pulmonary as well as the renal syndrome symptoms like rapidly progressive glomerulonephritis will be there. Next is autoimmune hepatitis. There are 3 types, right? Type 1, it is associated with anti-smooth muscle antibody. Okay, and ANA also. Both are positive in type 1. Type 2, it is anti-LKM, that is liver kidney microsomal. Okay, and type 3, it is associated with your soluble liver antigen and antibody, right? So next is scleroderma renal cancer, just we discussed about anti-RNA polymerase 3. Okay, so these are all the antibodies which are commonly discussed or used in the rheumatological disorders. If you know any more antibodies, you can mention in the comments. Thank you.